The goal of today, this is a launch. This is where we believe we're going to launch an action campaign today based on the discussion, the keynote framing the issues, a discussion led by the Sheila Shola from the Enterprise Foundation. I'm getting the name correctly. It'll take me a while. And a discussion with two distinguished panels. But one of the exciting things about this event is that it's a partnership in collaboration with Leading Age and Leading Age New York. It's a new partnership for CSCS, and we're very, very excited about it. I just want to recognize my board members, our board president, some other board members are here. If you stand up and just...
Not spill my coffee.
I saw some others who galvanized us and encouraged us to move forward on this new initiative that we're doing. Without further ado, I'd like to bring up Dr. Cheryl Phillips, who is from Leading Age, who I got the pleasure to know last evening, who's a geriatrician, but is Leading Age, a senior vice president for advocacy, and she oversees the organization Public Policy Development, Government Relations, and Advocacy efforts to benefit Leading Age not-for-profit members. I think the big news is, I was really excited, I didn't realize this, that she was at Unlock Lifeways, which was the country's first program of all-inclusive care for the elderly, or known as the PACE program. And she has a rich history of understanding policy, medicine, and bridging the social service spectrum. So it's my pleasure to ask Dr. Cheryl Phillips to come up and say hello.
Start off by saying this is really a dream come true, and I know your thought is, oh Cheryl, dream bigger. But 20 years ago, I was working in a healthcare system that happened to have an affordable housing complex, and I was charged with managing the high-cost frail elders. That wasn't a very good recruiting title to bring it into the program. Come to Cheryl's high-cost frail elder program. But my challenge was to understand what were the cost drivers. And 20 years ago, I tried to start the conversation with the hospital system that the answers started not in the emergency room, but in their housing complex. And they looked at me and they said, we're a hospital system, we don't do housing. The dream come true is that now, and you folks are remarkable leaders at this conversation is the reality. Healthcare systems are recognizing that those social determinants of health, we call them safe and affordable housing with service-enriched provision of the care that people need, where they need it, when they need it, and how they need it. They call it all kinds of other things. The reality is the answer to much of our complex challenges of healthcare delivery is in fact what all of you are trying to bring together. And so now I'm getting called, not unusually more than once a week, sometimes every couple of weeks, from insurance companies who are saying, how do we start talking to housing providers, and what's that LTSS thing, and which is also kind of a scary conversation given that many of these managed care organizations are rushing wildly into Medicaid long-term supports and services and don't understand the complexity and yet the simplicity of all it is that you guys are doing. So on the national side, we are spending time with accountable care organizations and Medicare Advantage programs or Medicare managed care, helping them understand that their real answers are not just reducing 30-day readmissions. My other dream is that we quit talking about 30-day readmissions and we start talking about the never admissions. That's really at the floor of what all of you are trying to bring together. And then on the managed Medicaid side, which you guys are in a whirlwind of, I realize, across the country, states are grasping rapidly And what they are looking for, they realize there's not a whole lot of cost savings on the Medicaid side, except by perhaps shifting some of the institutional or nursing home-based care into community settings. What they're really looking for is how to do it. So on behalf of Leading Age National, our commitment is to look at policies that are getting in the way, identify regulations, support, use new models, and most importantly, as Robin will be talking about, helping to gather the evidence so that the plural of anecdotes isn't data. We actually have the evidence to drive. So thank you for including me, for including Leading Age, and you guys really are a dream come true. Thank you.
It's my pleasure at this point to bring up Dan Heim, who's the Executive Vice President with Leading Age, formerly known as the New York Association of Home and Services for the Aging, the ASHA. And Dan has been in his role since 1989 as the Executive Vice President for Policy. Boy, he's seen a whirlwind. And he previously worked at the New York State Department of Health, and Leading Age represents over 500 not-for-profit and public organizations providing long-term care, senior services, and housing. My pleasure to welcome Dan as our partner in this.
Thanks very much, Yigal. Jim Klein regrets that he can't be here today. He does send his regards. So if you like what I have to say, I'm Dan Heim, and if you don't, then I'm Jim Klein. You're never mind. So I just wanted to say that we very much appreciate this opportunity with our partners at Leading Age and CSCS. This is a dialogue that we see as being long overdue, but very much welcome. Our association has been really a leader and proponent of developing and preserving affordable senior housing for many years. In your folder today is a summary of the white paper that we produced with Enterprise in 2012. We really think that it raised the awareness levels in Albany and elsewhere of the importance of senior housing and supports. And we are, most encouraged today to have not only many of you who work here in the city, but also state agency representatives. And it just illustrates to us that people are now beginning to realize, finally, that senior housing it's the ideal platform on which to deliver services. It ensures safety and security for many, many seniors. And it creates economic development opportunities as well. So there are a lot of good reasons to have that dialogue. One of the other things that Cheryl kind of alluded to is something we've been saying for quite a while as well, which is that senior housing with supports can forestall or prevent people from having to rely on expensive Medicaid-covered services. Many of the people we're talking about are low income and they're at risk. And we talk about the state having a prevention agenda, a public health agenda. We think part of that agenda ought to be to intervene in the lives of these seniors at an earlier point in time so that we don't have to rely so extensively on the healthcare system. So with all of that said, really greatly appreciate the partnership today. Hope that you all have a good dialogue today, and we very much appreciate the opportunity. Thank you.
The theme of the conference is threefold: is production, preservation, and regulation. Those are the three areas that today we'll focus on. You're not going to be going to any other rooms. Everything is happening in this room here, and we're very excited. So we have a lot packed in a short period of time. We felt it was very important. But the goal of today is an action agenda on affordable housing for the low-income elderly. I'm just putting that out. It's very clear in what we're trying to accomplish. In the area of production is increase the sponsorship of new senior housing with services in New York City over the next 8 years. Advocate for comprehensive solutions to keep older adults safely housed in apartments with permanent affordability. And reform housing codes to permit the establishment of new housing models to address the shifting needs and demographics of our city aging population. In your packet You have the demographics of New York City. You have executive summaries from our long-term paper, from Leading Age, long-term paper, and looking at that. So please, and we will send you a resource list, including Jennifer O's PowerPoint presentation after the conference, as far as that goes. I just would like to just recognize the hardworking planning committee, who since May has been meeting almost weekly, either by phone or bi-weekly in person, felt that this was so important. If you let me just announce their names. Susan Albrecht from the Association of New York Catholic Homes. Susan, I know you're here. David Gilchrist from Project Find. Laura Jervis, you'll be hearing more of, from Wisfish. Noreen Hitsley from the Marketing Specialist from Leading Age. Nancy Hooks, Leading Age. John Kateris, who is our past board president and is co-chair of this conference with Laura Jervis, who's done a remarkable job with John Napolitano, who works with him. Kristen Myers from Leading Age, and Evelyn Wolf from Self-Help. They deserve... And I do want to recognize some of the staff at CSCS who really, behind the scenes, put this together. And really, you were the glue that held it. Dina Sandos, who's in the back. Dina, raise your hand. And Allison Nickerson. And of course, the rest of the staff, and Bobby Sackman, our Director of Public Policy, will hear more as we go forward. It's my great pleasure now to introduce the Director of the State Office of the Aging, and who I know for at least 15 or more years. In 2007, he was at the State Office of the Aging. In 2010, he became the acting director. For some reason, I don't know why they don't take acting away, just make him director of the State Office of the Aging. But he really gets it. He's a real advocate for community-based services. He's at the table in Albany. He's a friend. And so we're delighted that he was able to come down here this morning, spend a few minutes with us and give us readings.
Thanks to Gal, and good morning, everybody. It's really great to be here, and congratulations to Gal, CSCS, and Leading Age. This really is timely and really is important. Affordable housing, and I'm going to add the term enabling housing in there as well, because along with affordable housing, we need to make sure that the housing stock, whether new or retrofitted, allows people, as they are changing functionally and getting older, to use the housing that they're in as their needs change. And so the enabling housing piece is important as well. This is really timely and really important regardless of who is paying for your health insurance benefits. This is important for all older adults, persons with disabilities, because housing is obviously a right and a huge need. Here's what we know, though, today. We know that the population is getting older. Everybody knows that. In 10 years, and on an aggregate basis, 25% of the population will be over the age of 60. In communities like New York City and some of the boroughs, that number goes up exponentially, but that's an aggregate number. In 10 years, over 4 million, 20% of our population will be living in the community with a disability. We have 90% of our older population with at least one chronic condition, 75% having 2 or more. The next set of older adults, the baby boomers, equally, 70% with one chronic condition, 60% with 2 or more. And then all the things that are happening, from the Affordable Care Act to Community First Choice Option, Medicaid redesign. I know Liz Meese is here, who will talk probably a little bit more about that later. Managed care for all, health homes, this whole direction really to incentivize community-based options first, homestead implementation, is going to mean we're going to have more and more people, not only of older age, but of younger age, that need assistance, where the bricks and mortar type of arrangement that we heavily depend on isn't going to work and does not work for this population. I think coming from a state unit on aging and working in the aging network with how we're organized in our culture, where we take services to individuals' homes, this is really a natural partnership when you look at melding physical health, behavioral health with the human services side of the street. And I think what research has continued to demonstrate over the last few years is as behavioral health and physical health is being integrated through a variety of these models, what's clearly missing and has been articulated as been missing are those non-medical community-based long-term services and supports that are provided through the area agencies on aging, many of the subcontractors, the faith-based community, and so on. And certainly with the implementation of the Affordable Care Act, more people have health insurance. There's a much bigger emphasis, as you heard earlier, on evidence-based interventions, on really implementing prevention strategies, both to contain the cost of Medicaid, but really to have an avoidance strategy, which I think that our network does really, really well. Also, what we know is that the demand for affordable housing is astronomical right now. We have huge waiting lists. The numbers of slots seem to be going down, certainly has over the last 30 years. And that's something we definitely need to pay attention to, as we're going to have more people in the community that are going to need these housing options. And so what really this means, and why I think this is so important and so critical, and I'm really interested in learning from all the folks on the panel today, is we really do have to have a planned, purposeful, organized strategy to not only build housing, retrofit, make sure that the housing stock that we have remains online, because this is something that we certainly have to do. So we are definitely supportive of this housing model, do think it's the right time to really integrate and tap community organizations to rally a variety of support services in a holistic way around the individual in wherever their home is at the community level. In the housing complexes now, the census of the individuals living in these housing facilities really look a lot like the individuals that we're currently serving in the aging network. Traditionally, older women in their 70s and 80s, a number of chronic conditions, needs in their activity, daily living, and IADLs, at nutritional risk, having depression, anxiety orders, living alone, and we also know that those are the risk indicators for nursing home placement. So I think, figuring out a way to institutionalize and structure a housing agenda with support services is really going to make a very important impact on not only the individuals being served, certainly their caregivers, the outcomes in terms of their health and quality of life, but it's going to have a significant impact on healthcare spending, long-term services and support spending. And at the end of the day, this is really about building partnerships so that people aren't falling through the cracks, and we can rally all the resources around an individual that they need based on whatever their assessment is. So congratulations to you, everybody that's here. This is extremely important, and I look forward to learning and being part of, hopefully moving an agenda forward that's going to allow people to age in place, the conceptual age in place in reality at the community level. So thank you, and enjoy this great day.
Thank you, Greg. Terrific. I just want to also a shout out to our sponsor, major sponsor today, Custom Computer Specialists, who came through on short notice. We really appreciate you coming through and supporting us, and I hope everybody gets a chance to spend a few minutes with you. It's my great pleasure right now to bring up Laura Jervis, who's co-chair of the conference, who's been at WSFISH since its founding in 1977, and which has 24 buildings, serves an array of senior services in terms of mental health, substance abuse, homeless, and elderly. So Laura Jervis, the Reverend Laura Jervis.
Thanks, Gal. It's really quite extraordinary to look out at you this morning and to see the whole spectrum of providers of both housing and supportive services to older New Yorkers. And to me, it strikes me as a symbol of your commitment to a better, healthier, safer future for the elders we serve. So thank you so much for being here. As co-chairs, John Kateris and I really want to do another huge thank you to CSCS. Without their initiative, their organizing, their ideas, their coordination, this never would have happened. So thank you, Igal, Bobby, Dina, Allison, all of you. Thank you. So as Igal said, some of you probably have heard that there is this drama going on in Washington, D.C. And along with all Americans, our symposium has been caught up in this R-rated reality show. As a committee, when we were doing the planning, we were very, very excited that Jennifer Ho had agreed to be with us. She is the special assistant to our own Sean Donovan, the HUD secretary. And she really was excited to be our keynote speaker. And I think I was the last email she wrote before she turned the lights off. She is the HUD honcho on the integration of health and housing for older people in the United States of America, and yet she is not an essential person. So along with those 800,000 other federal employees, she is forbidden to work during these days. However, with due respect and affection to Jennifer, who we depend on and adore, we were calm and we carried on because we have Robin Stone. Those of you in the world of aging services know that Robin is a rock star. Her fingerprints are on every positive piece of aging and long-term care policy for the past 30 years. Her service in the Clinton administration as Deputy Assistant Secretary for Aging and Long-Term Care is only one of the hallmarks of her stellar career. She is now the Senior Vice President for Leading Age and is the Executive Director of their Center for Applied Research. She's located in Washington where the action is, and she's part of the dynamic future of our planning for aging services. And she knows that housing is the linchpin to healthier older adults. And like every great rock star, she has lived in New York City when she was the executive director of the International Longevity Center. So Robin knows New Yorkers. She really knows us. When putting together the conference, Robin was always part of the plan, and she was to be the responder to Robin Stone. So to Jennifer Ho. And we are so grateful that she has expanded her remarks to set before us the national perspective on the challenges and opportunities for integrating housing with services for older New Yorkers. It is a privilege to introduce Dr. Robin Stone.
It scares me when I hear these things. It's kind of hard to be a rock star, and also since I've been in this since I was 26 and I'm now about to be 63, I am truly aging in place. And yes, I did spend some time in New York, and I love New York, and sometimes the center of the universe is in New York, sometimes it's not in New York. When we had our conversation on the phone about what I was going to say as both now the keynoter and the responder, one of the big questions was, how do you bring something to New Yorkers when New Yorkers frequently think that the sun rises and sets on particularly New York City, not to mention the entire state. But I think we have a lot to learn from what's going on all over the country. And I'm increasingly convinced that everything is local, so that a lot of the models, whether it's in the center of New York City or in some rural community, have attributes that can be adapted. And so we have to be very open in terms of thinking about how we look at the future of affordable housing of senior housing and the important linkages with both support and health services. And also think about the opportunities as well as the challenges. I know you guys are facing some things right now, for example, around assisted living regs that may have and do have potential implications for independent housing. And yes, some of these things are challenges, but I think we also need to think of them as opportunities. We need to educate policymakers at the federal, state, and local level about what gets in the way and what's going to help us create better infrastructure for older Americans today and tomorrow. And I want to start by just giving you the sort of the essentials that we've already heard. If we don't know the population is aging, then we're on another planet, right? So we already know that. I think there are a couple of things that are going to change dramatically over the next 20 years. New York is already probably in the forefront of a few of these. One of them is tremendous diversity of the population. It used to be that we had a lot of primarily white elderly people who were being cared for in many cases by people of color and different ethnic and racial groups. But over the next 20 to 25 years, we're going to see dramatic increases in the diversity of the elderly population. First time ever in the demographic history of the world that we will see real changes in that diversity. You know, a lot of these younger people are aging. We don't stop. We keep on aging, and all of those non-white, diverse people are aging. And so a third of our population over the age of 65 within the next 20, 25 years will be non-white. And that has really significant implications for everything that we do, including not only the services and the systems and the housing that we design, but the questions around cultural competency and really understanding our populations in a more nuanced way. But the other thing is that the non-white elderly population is much more likely to be lower income. So we're going to be looking at tremendous increases in the demand for affordable options. Now, we add that diversity, we add on top of that, we layer on top of that post-2008, where we know, and the image, quite honestly, of the elderly is that they're all, and we are, I'm almost, well, if you're 60, I'm already there. If you're 65, I've got a couple of years. But we're all wealthy, we're all healthy, we're all going to live our lives out in our own homes and be perfectly happy, and then die at 95. But the truth of the matter is that, as was said before, as we age, we are all faced with potential for greater disability, more chronic conditions, and now we are seeing tremendous implications, particularly of post-2008, for the economic security of today's elderly and tomorrow's elderly. And this is probably the biggest change and misconception that we have in this country. We need to turn that on its head. I'm not going to give you all the dirty, ugly statistics, but we have a heck of a lot of people who are in just approaching retirement who have no or very little savings. We have reached a plateau of home ownership and wealth in home ownership. We will never see that again at that same level. We have a lot of cohorts coming up that have no assets or wealth in homes. And by the way, asset in homes was a relatively recent phenomenon anyway. It was sort of a blip on the screen. So we need to be thinking about the future of affordable housing for probably at least half to two-thirds of the elderly population cohorts coming up. This is the biggest sleeper question. Will not be solved by HUD, will not be solved by any of the state housing financing agencies because the problem is way too big. It needs to be solved by public-private partnerships and all of us starting as advocates for a new view of policy around housing. And one of the things that we at Leading Age did about 10 years ago, and we started from the provider perspective, was that we realized that we've already got something to build on, and that is our affordable housing today. We have a history of affordable housing. We have over 2 million elders who are living in some type of publicly subsidized housing around the country, whose median income is a little over $10,000. 20 to 30% of them are currently over the age of 80. You know, those of you who are in housing, you remember these were all folks in their early 60s. They're now in their 80s. And average age of move-in is 74. So it's no longer 60. So we are already looking at a given of current existing stock that we can use as both guinea pigs for model development, as well as advocacy around how we move what we have today into growing that for the future. Because the truth is, with our waiting list, we cannot assume that we're going to be able to rest on the laurels of having current affordable housing stock. It just isn't going to happen. We can do a lot around preservation. We can do a lot around using housing as a platform for linking services and helping people to age in place. But we, at some point, and policymakers need to get this, we are going to need various affordable housing options, whether they're vertical, and certainly they're going to be vertical in the middle of New York City. Some may be horizontal. Some may be spreading and expanding the concept of the naturally occurring retirement community in a way that brings both bricks and mortar and services together. But, you know, we cannot be sort of the silent majority anymore around this. Housing has had a hard time. You know, I'm an advocate for long-term services and supports. I always call that the bastard child. Well, affordable housing for seniors is the bastard child. It is really, really difficult to keep it on the radar screen. And as everybody has said before, I think we've got an opportunity right now. A lot of the stars are aligned. First of all, we have some policymakers, some at the federal level, Jennifer as an example, as well as a lot of state folks and local people who are now recognizing the importance of housing. It may be because they see housing as important for the homeless and it moves into other populations. It may be because they're trying to implement money follows the person and they realize that they can't take a person out of a nursing home if they don't have a home. What a brilliant concept, right? Or it may be the Atul Gawande article in the New Yorker about hotspotting, which is where did they find all those high-risk people in Camden, New Jersey? They found them in publicly subsidized housing. By the way, the largest proportion of people in that public housing were seniors who were high users of hospital and health care. And once they got that and began to think about public housing, publicly subsidized housing as a population-based approach to managing health and supportive services, things have changed. And the Camden Healthcare Coalition got started. They are actually working with Northgate, which is one of Leading Age's members, a large public housing complex, to not only develop the services system, but they're working on a very sophisticated electronic health record mechanism for linking housing with the hospitals and the health system in the area. That can be done anywhere in the country. Some of the work that my group is doing right now with money from HUD and HHS, we have been able to link HUD data, administrative data, with CMS, Medicare and Medicaid claims data for 12 jurisdictions, including New York City. We are finally, it took us 2.5 years to get access to the data, but we finally have linked it, and we're beginning to look at the data, and we know that seniors living in low-income housing are at higher risk than the average population. We know that they have more chronic conditions, they have significantly more mental health problems, they have many more functional problems. So there is both a challenge but also an opportunity because of the economies of scale of a congregate setting, the way in which housing typically has an infrastructure, including frequently service coordinators that may be supported by HUD or may be supported by other kind of operational budgets. There is an opportunity to think about publicly subsidized housing as a platform for addressing some of the thorniest problems in the United States today. And whether that is reducing hospitalizations or rehospitalizations, whether, as Cheryl said, it's keeping people out of it to begin with, which is we have great opportunities for early intervention around prevention, health education, chronic disease management, prevention of social isolation, addressing depression, looking at chronic mental illness and substance abuse, which we have in a lot of our properties, and thinking about a whole constellation of ways in which housing itself, as well as partnerships that are formal, can make a difference in the lives of these folks, help them stay in their apartments, and these are their homes for as long as they would like, and perhaps even become a hub for the larger community. How many of you guys are senior center providers? How many are housing providers? How many are adult day or other types of community-based services? So we've got a bunch of different kinds of service and housing providers here. How many of you work together on an ad hoc basis? So you're already doing a lot of partnering, right? We're not talking here about a rocket science approach. We're talking about formalizing what has already been happening in aging communities for the past 35 years. And, you know, the Aging Network is a perfect example of an infrastructure that was created to try to really make this happen. But now we want to talk to the Medicare and the Medicaid folks about making those relationships more formal. And we want to talk with our health partners. We want to be talking with our hospitals. We want to be talking with our accountable care organizations. We want to be talking with our Medicare Advantage plans, our special needs plans, our federally qualified health centers, our mental health clinics. Whatever we've got in our community needs to be a partner with us. And by the way, we're not just a silent partner in all of this. We need to get to the point where we have enough volume and we have enough return on investment in information and enough courage to say we want to be equal partners, or at least we want to be a major partner, which means that if you're a managed care plan and you're getting a capitation rate, and we can manage through our service coordination a full population or maybe a few populations in our housing and within the catchment area, we want part of that money. If you're saving dollars out of the hospital because you're keeping people out or you're keeping them in their apartments once they come back and they don't bounce back, not just 30 days, we're talking about 90 and 120 days and past, because unlike most service coordination, in public housing, we know where people live. We're in their apartments every day. We can see what they eat. We can look and make sure that they're not going to fall. We can really manage that post-discharge. We want part of those savings. Now, that's not going to happen overnight. We don't have the capacity to do it at this point. But the point is that this is the opportunity for us. In the short term, is to take advantage of every single piece of the Affordable Care Act that we can. Every demonstration, all of the Medicaid managed care work that may be happening here in New York City is housing at the table for all of those discussions and all of those developments around partnerships. And as I said, not a silent partner, but an active partner. Now, what does that mean for you guys? The first thing is it means that you have to know who your residents are, right? So I go into a property, we do a lot of research in properties, and we'll talk to a service coordinator, and they'll say, oh, we know what's going on with our folks. And we find out that they know what's going on with their folks, about a quarter of their folks, because those are the people that come to them. That is not knowing your entire population. You need to basically think about how you're going to assess and do needs assessment on a periodic basis of everybody that lives there. on a voluntary basis, of course, because it's all independent. But nevertheless, the opportunities that are there for you to really understand your population base and then make better judicious decisions around how you allocate resources, what kind of partnerships you need. Do you really need to be co-locating an adult day center, or is there something else that you need to be doing instead? And we have had providers at Leading Age who thought they were going to be doing one thing, and when they began to do standardized ongoing assessments, realized that they had very different problems. A lot of mental health and depression, a lot of chronic disease management, a lot of social isolation, a lot of functional needs and falls that needed to be dealt with, and a lot of medication management. And that begins to sort of raise the spectrum of where you want to put your resources and how you think about managing an entire population. It really is, I'm an old public health person, that's where my doctorate is from, and it really is a public health approach. And honestly, if we could get our housing together with our public health departments at the federal, forget the federal, public health and federal has some serious problems, but at the state and local level where public health is really pretty active, if we could get housing interjected into the notion of public health, that it is, as Cheryl said, it's one of the social determinants, right? You don't have a roof over your head, that's like Maslow's hierarchy. But not only is it the roof, but it's the platform. So we need to be thinking about that. We need to be thinking, how do we partner with our public health departments, and you've got a really nice, strong one here in New York City, to think about managing from a population perspective large swaths of folks who are at high risk. Even our low-risk people in publicly subsidized housing are at higher risk than folks who are living in the community. So we've got a lot of things to offer to public policy people. And we need to be able to make that case. But you can't make it with a one-off anecdote. You need to have data. We are trying as hard as we can to get these data from HUD and CMS together so that we can start to show a more clear portrait of utilization, risk, and potential for management and investment. But it also has to happen at the provider level. And it has to happen at the community level, which is one of the reasons that I think the community is such an important piece. Because it's hard to do needs assessment at a larger level. You really have to do it where your properties are and where your people live. And so to me, that is the greatest opportunity for us. Now, our goal at Leading Age is not just to talk about a housing with services strategy, but it's also to use that housing with services strategy to demonstrate how important affordable housing is on its own as well as a platform. Because we believe that through these kinds of partnerships, we're going to be able to argue for more investment in the affordable housing side. As affordable housing itself, and as a product that links both the housing and services. We're beginning to see a little bit of traction in this area. In Ohio, there's actually, one of our providers is actually having some discussions with managed care about even thinking about their investing in the bricks and mortar for more affordable housing as part of their managed care strategy. Now, whether that's we don't know how that's going to play out. But it is a discussion that's worth having. We also have a provider, and I was told not to mention Vermont because Vermont is so different from New York. Well, it is, but it really isn't. Because if you think of Vermont as a big community, Vermont is like a big community like Manhattan. Except it's a little bit more horizontal and more white. So in Vermont, a large provider was able to work with the state to develop a model of mega service coordination that basically includes a service coordinator and a nurse model in each housing property. There are now about 65 housing properties engaged in this model. Both 202s, low-income tax credit properties, as well as public housing authorities, are all part of this program. And what they've been able to do through a Medicare coordinated care demonstration that is happening in Vermont is they have gotten money from Medicare to pay for this service coordination. Now, this is the first time ever in the history of the United States that Medicare has paid for housing. But it is an example. It is an example of what we can do if we start coming together. And early results of my organization is part of an evaluation of that model in Vermont. We're starting to see early results. They're incredibly promising in terms of significant reductions in hospitalizations, strong partnerships with primary care and hospital systems, and a real return on investment, not only for housers, but also for the Medicare program. So, this is just one example. We've got examples all over the country. You've got them right here in New York City. We have a learning collaborative of 12 housers and service providers, self-help from New York City as part of that learning collaborative, funded together, actually not really funded, it's actually created by Enterprise, Leading Age, and an organization called SAFE, Stewards of Affordable Housing. In that learning collaborative, we are beginning to share best practices on how to link housing with services, how to develop these relationships with healthcare and supportive services, how to do assessment, how to get more involved in resident engagement, how to use technology in a creative way that's affordable for low-income housing providers. And as we move along over the next year, we will be making a lot of these products available. We're actually going to be doing a toolkit on how housing partners with healthcare this year. That will be one of our products. The second one will be a product around resident engagement. So things are happening. Things are happening right here in New York City, and you guys probably have 1,000,001 other stories. But we have to turn those stories into evidence base. So that's probably the message that I'm going to leave you with, is that if we don't have information and data on our residents, and we can't show what we can do, then it's really hard for us to go to a policymaker or to go to a health partner and argue that we want to be equal partners. And by the way, Jennifer would have told you this if she were here, because we often get pushback from our housers that we can't do assessments. Yes, you can do an assessment on every single resident. You cannot use data to keep people out of coming into your property because there are fair housing laws. But you sure as heck can know about every person, and as long as it's voluntary. I think down the road we're going to have struggles around regulation. This is not just New York, by the way. California struggles with the same issues of questions around regulation of independent living, and when does one become, for example, a healthcare provider? But let me tell you that other states have figured that out. Minnesota, for example, just regulates services. It doesn't regulate the properties. Similarly, the same thing is going on in Connecticut. So, nothing is set in concrete. We have great ability to open the eyes of our policy folks and our consumers, who are often, and I hate to say this, but they're often their own enemies. Because in arguing for heavy regulation, we don't allow for the kind of creativity that can happen with independent living. And that is really where people want to stay, in their least restrictive environment and in their homes. So, I know that Eval talked about an agenda for action. I believe, and I've been in D.C. on and off since 1974, I've never been in more conversations where housing is actually on the agenda, not only on the agenda, but front and center. Some of this came because of the homeless. And of course, the homeless, it's almost a no-brainer. A person who doesn't have anything, you give them a home and you give them some supports, and you are going to, just by virtue of doing that, improve quality of life and save money. But the same thing holds true for many of our other populations, and I would argue that we have a lot to be able to look at for our vulnerable elderly. And we need to do that advocacy to move the policy levers along for helping us to create affordable, enabled housing. I love that term, enabled, because it's enabled physically and it's also enabled service-wise and emotionally. But to argue for an enabled housing strategy for what we have today, and then to make it clear that the thousands of people on our waiting lists are just the tip of the iceberg. And what are we going to be doing about new construction, preservation or transformation of structures that may be out there that could be redeployed, as well as new investments. I was just out in California and I had a bunch of banks coming up to me in Northern California talking about their interest in looking at some of these models. They weren't the big banks. One of them was Union Bank. There were smaller banks that are actually interested in thinking about some of these new products. So I think we've got opportunity to talk with a bunch of new folks. Our partnership with Enterprise and with SAFE has been a wonderful one because Enterprise in particular really brings that strong lender orientation and community development. And in essence, that's really what we're doing here, is we're talking about community development and economic development. Any new construction would actually also bring jobs. New transformation of technology in our properties would be also economic generators. So we need to think creatively about this and be at the table. I want to thank you for the opportunity for me to talk here. I don't have any super solutions because most of them are pretty much common sense. I'm assuming that most of you housers have a service coordinator. Some of you may not. If you don't, then we need to be thinking about strategies for starting by getting an investment in that particular piece of the infrastructure, whether that has to come from your own budgets, leveraging other dollars, partnering with a hospital or a healthcare provider or a AAA or whatever, where you make the case that it's probably better to have that coordination in your property than having 5 other people come in, which is tremendously redundant. And that not only could you be doing it in your own, but you could be doing it for the community around, particularly in places like New York City where your density is optimal. So we have to start with where we are, and then we have to build on that. We have to make that ROI because the return on investment is going to be key. We will be trying to do some templates for return on investment in this toolkit that we're going to be working on, but it's pretty straightforward. What are you doing to keep your folks successfully aging in community? And by doing so, what are you saving? For the Medicare program, for the Medicaid program, for housing, we are seeing savings for HUD because every time we do this, we actually help to maintain apartments, which is extremely costly. For any of you housers probably know this, but maintaining property, maintaining apartments is really key. So we have all kinds of ways of thinking about calculating return on investment. But that's the way we're going to be able to start getting into these negotiations in a much more strong fashion. I think you guys, sometimes we don't look at New York as the innovators, but a lot of times we do. I think the Newark concept was, it didn't start here, but it certainly became perfected in New York City. Partly because you are the center of density. If we can't do this here in New York City, we can't do it anywhere. You have more people per square inch living together. I know. I lived in a geriatric building. And the super came to me all the time because he knew I was a doctor and he thought I was a medical doctor. He used to knock on my door because there were people, the woman next door to me had significant cognitive impairment. She was often outside in the middle of the night, walking around downstairs. And the super would come to me and say, what am I going to do here? Perfect perfect environment for organizing services and an infrastructure and saving the city money and saving the state money and frankly helping these folks. So, this is the place to make it happen. I hope everybody's all the policymakers' ears are burning. But I also think it needs to start from the providers. Because we're the innovators. It's hard for policy to really be innovative. So I wish you well with the rest of this meeting. I'm sorry that Jennifer couldn't be here. She's quite the advocate for these issues at HUD, which is fabulous. You probably have the best opportunity right now at HUD that you've had in years for thinking about this kind of agenda. And they also are interested in partnering in I've been through many MOUs with HUD over the years and nothing ever happened. This time around, I think there are some really strong connections that are happening that are hopefully going to move the ball. So I look forward to the rest of the day, and thank you so much for the opportunity.
I guess, there are many here who are housing providers. There are many here who are service providers. And then there is a subset of people who are doing both. And it is that group that I think we should all be striving to move toward. Using housing as the platform for services is what we have heard for the last hour and what we are going to continue hearing for the rest of our professional careers, in my opinion. One of the points that Robin made in her comments had to do with the voluntary nature of participation when people are living independently. And we believe that being able to provide services if and when people need them is key to the model of housing and independent living services. So whether or not those services are social services or healthcare services or other supportive or entitlement services, the individuals, one day before they moved into our housing, were living in the apartment across the street. And when they lived there, they were able to receive those services independently. When they move into an affordable housing, they should be able to continue to receive those services. But now we have the ideal of, if you will, critical mass, which provides the efficiency model to be able to deliver those kinds of services. And so we think it's efficient, it's effective, and it's what people want. Therefore, it's a winner all around. Now we just have to get policy and funding to follow.
Well done. 20 seconds to spare. Thank you, Stuart. Elizabeth Misa, who is Deputy Medicaid Director for the Office of Health Insurance Programs with the New York State Department of Health.
Oh, thank you. And thank you for inviting me to attend. I've been doing housing for a little over a year, so I definitely know I have a lot to learn. And I'm happy to report that the state of New York and the Cuomo administration, has shown extreme commitment to housing, and that we do get it. The social determinants of health, like housing, is directly related to health care. And that's why with Medicaid redesign, what we're able to do is take state-only Medicaid dollars and invest those dollars into housing. Because that, we know that when we place individuals into housing, not only does it improve quality of care, but it also decreases costs for the Medicaid program. And our goal here in New York is to take those dollars saved and reinvest them back into housing. Over the past 2 years, we've reinvested a little over $160 million into supportive housing initiatives across the state. We've been able to provide housing to a little over 5,000 individuals through a combination of new capital dollars, service subsidies, and supports. And the good news with Medicaid redesign is we are tracking outcomes. With every individual who receives housing through the MRT, we're asking to collect the Medicaid identification numbers of those individuals. And what we're going to demonstrate both at the state and federal level is that housing works and it does decrease Medicaid costs. So I think it's a very exciting time to work on housing in the state of New York.
Great. Thank you, Elizabeth. We are going to ask Richard Brown, who is Senior Underwriter for the Multifamily Program with New York State Homes and Community Renewal.
Good morning. My name is Richard Brown, and I work for New York State Homes and Community Renewal. In my position, I'm on the finance side, and we really look at providing the capital dollars to get multifamily apartments built and or renovated. So from my perspective, from ACR and specifically from the New York State Housing Finance Agency, which is where I work, we look at gathering the resources necessary in order to build the housing. One of the main things that we do is that we issue tax-exempt bonds and tax credits in order to build housing. And that often involves very complex public-private partnerships. We work with Enterprise on several deals, as well as all the other banks and syndicators out there. So for us, we're finance people. And the health side of the marriage, as this really is becoming a marriage, it's a little bit foreign to us, and it's almost like a courting stage now. We're learning some of the language from the health side. They're getting accustomed to what we see on the capital development side, and there are a lot of things that we need to take into consideration as we develop programs going forward. I guess I'll just finish my brief statement with the one thing that HCR in general strives to produce in looking at the production of housing is housing that benefits communities. And when you look at the areas that we've been focused on over the last few years, either the Mitchell-Lama rehabilitation or the MRT or transit-oriented development as strong community base. And that is a big part of what we look at when we look at deals that we're going to finance going forward.
Great, thank you. Last but not least, we have Diane Darbyshire, who is a Senior Policy Analyst with Leading Age New York and a good partner with us. Diane?
Thank you, Sean. So at Leading Age New York, I don't know if you're familiar with our organization, but we are looking at the entire continuum of aging services. So every time we look at a policy issue, we're trying to understand how it's going to affect the continuum and the experience of seniors in the state. So in this regard, we really feel as though affordable housing, the development and the preservation of affordable housing is really critical to the future of aging services in New York. And we really, I think it's actually a really exciting time. We really applaud DOH and HCR for working together. We had a wonderful victory this year in terms of getting some money through the MRT Affordable Housing Work Group process to test out. I think what we already all in this room know that investing in some supportive services in affordable housing and also investing in some capital improvements will result in Medicaid savings. I think it will also result in Medicare savings as well. And in New York City, I think we'll have the opportunity to evaluate that a bit more as we move into a FIDA environment, the dual managed care demonstration that will start soon. So we really appreciate the hard work of the state agencies, and I do think, and we probably experience it in this room, that it is kind of, it's not easy to do. You're kind of speaking different languages, and I think we're all learning from one another. But I think there's a great opportunity here, and our hope is that this initial senior housing pilot will help us collect that data and really demonstrate the way Robin talked about that this is really worth further investment because of the significant return. I think it's important to note, too, that there's not, obviously, I mean, I'm talking preaching to the choir, there's just simply not enough capacity in the state. And we have an aging infrastructure, and there's not enough funding to really update that and enable aging in place. So I think that needs to be a focus as well, particularly as our federal funding is drying up. So.
Great. Thank you, Diane. So now I get to play presidential moderator and come and sit and ask you all some questions. So bear with me while we our mics on. And there are some seats further down. Folks who are standing in the back. Please come on down. I'm not sure. Okay. So all of you have referenced the work that's happening here in New York State around Medicaid redesign. So let's talk a little bit about what programs have been funded through the Medicaid redesign work, and there have been some deals that have closed. What have we learned? So let's start with Elizabeth, and then maybe Richard.
Sure. So I think we have funded almost every type of housing model with the MRT, which I think is very exciting. We've funded capital construction projects to house new individuals. We funded programs specific for rental subsidies and service supports. We focused on almost every population in need of housing. Individuals who are homeless, individuals who have mental illness, substance abuse, seniors, individuals moving out of nursing homes. So I think that that's the very interesting work of the MRT. There are specific programs specific to seniors that we're looking at. Two are pilot projects that are newly launching in the fall. We're hoping to get them up and running as soon as possible. But one pilot is really testing the model to help seniors age in place. And we're providing funding through the MRT to assist with minor capital improvements and service supports, because we think that if a senior has a ride to the doctor or has some minor capital improvements in their current housing, that they're more likely to remain in the community and less likely to move into more costly care. We've also heard from the City of New York that seniors in shelter has also been an issue, so we dedicated Medicaid redesign funds to move seniors out of shelter and into the community. There's another pilot that we're newly launching as well to move individuals out of nursing homes into the community or divert individuals from going into nursing homes. So those are just some samples of some of the specific projects that we have funded that are very new. And I will say that the work of the MRT Affordable Housing Work Group, it's over 40 stakeholders. I see a lot of members in the room, and I think it's the hard work of all of the members and their suggestions that really lead to the success of Medicaid redesign. It's not just one person sitting in a room in Albany who is making a decision and they think they know what's best. We also, engage the stakeholders and the people on the ground who are the experts, and I think that that's really the key. So I do want to thank everyone in the room who's been an active participant. And the good news is we're going to start our work again next week, October 15th.
Great, thank you. Richard, any response to that, or Stuart, as someone who's actually working on deals that are using MRT dollars? Any reaction?
As a result, MRT came upon us very quickly in the scheme of things. Things usually move in geological time, but MRT faster than lightning. I believe the types of projects that we are seeing coming out of them, which often call for the integration of various populations, is a wonderful model. So from a conceptual standpoint, that works. I think some of the policies and funding that have supported those type of services in the past need to be visited so that we are also integrating the way we implement this at a provider level. How do you integrate the funding of OMH, DOH, Department of Housing Services, Homeless Services, and then at the city level, you have co-located a senior center or adult daycare program. So we've talked about how to leverage the social services or human services, and what we need, I think, to visit is how do we take some of that excess, and this is all about making it more efficient, how do we take some of that excess cost out, because we're duplicating some of our efforts, and importantly, the clients who we're seeking to serve, well, we could say we could take this population and have them here, they're receiving the single funding stream from days gone by as opposed to a homogenized funding stream and policy. So we have not yet actually lived that, but in the planning stages, we see that as one of the barriers to moving more quickly to serve the clients where they need to be served.
And I guess just to follow up on that, as there are several different streams of funding on the operating side, there are also several different streams of funding on the capital side as well. In your traditional projects that are funded, through HFA, you have tax credits, which is a tax credit program, has been very successful in producing housing. You have tax-exempt bonds, and they come with their own set of rules to begin with. And then, so you have funding streams that are set up for traditional low-income housing, services. And then you have a population that's coming in with service needs that on the financing side, we really didn't look at as much before. There may be issues on design, there may be issues on with regards to operating expenses and how financially viable that the building is that we need to take into consideration now. And as I mentioned earlier, the work that we do involves several other partners. So not only do we need to be comfortable with it, but they need to be comfortable with it as well. That the source of funding on the operating side will be there, that they also have a clear understanding of what that funding is, so that they can go ahead and commit to the building of the project. And on our side, we have to have a good idea so that we know what it's going to cost and whether even the capital dollars that we have are enough to even get the building built. Because at the stage that I'm involved with the project, the housing isn't even built yet. We're talking about projects that a couple of years down the road will be ready for occupancy. But just the process of getting them to the point where you can begin construction is often a two-year lead time. So it takes a lot of coordination and planning to make it work.
So we heard about sort of service integration, and we'll talk a little bit more about that, but there sounds like there's a sort of the capital program coordination, and the MRT work group is, I think, an example of that. What's next for the MRT work group this year? What's important for those group of stakeholders to be focused on moving forward? Looking at you, Liz.
Well, I say that's the question. We were meeting down in the city on October 15th, and that's probably one of the last agenda items at the meeting. What are the priorities of the stakeholders for 14-15? I think that we're very committed to the program, and we're very committed to increasing funding for the program. So the goal is to maybe have some additional dollars to play with this year, and to ask the stakeholders what their priorities are moving forward. And this time next year, as the data rolls in, I think it'll get even more interesting, because then we'll be able to figure out how much the programs are saving, how much more we have to reinvest in supportive housing, if some models of housing are working better than others, what best practices we can learn from each other.
And I think it's important to note that this is really the first round of investment in affordable housing and services for seniors. And we haven't gotten that out the door yet, so we don't have the information yet. So I think it's really critical that people in this room be thinking about innovative ways that you can be achieving Medicaid savings, to really take advantage of the opportunities that are coming. And I think it's important that we go down the road of pursuing projects that we know are really going to work well and demonstrate it so we can get further investors, so we can get buy-in from the legislature to really continue investing in aging services and affordable housing. And I will say it's a very active and passionate group, so it will surely be a lively discussion next week. But I think perhaps we should have a service coordinator just for the financing, right?
Sounds like it. That could be a priority on the next one. Robin mentioned, which is a startling figure, that in publicly assisted housing, that population is even more vulnerable. And so that's sort of one challenge. Then we understand there's the preservation of existing affordable housing. So from the state's perspective, Richard, I'd love to sort of get your take on what's the state thinking about preserving existing affordable housing, and how are you thinking about transactions and deals and advice for folks in the room as they're looking at preserving housing where people are already aging in place?
Well, currently at HCR, one of the big initiatives that we have is the preservation of the current state Mitchell-Lama portfolio. There are about 45 properties that we are working on refinancing and renovating those properties so that they can remain affordable, remain in the Mitchell-Lama portfolio, and can extend the use of the buildings. In general, from the financing side, it always comes down to what resources are available. It's very expensive to not only build, but also to rehab. A lot of the existing projects that we deal with may have outstanding mortgages on them that we have to work with as well. Then you have the population themselves, and if I would say, I guess for preservation projects, if there is not already a dedicated source of revenue for rental assistance, Section 8, or the variety of the HUD contracts that are out there, then it becomes very difficult to upgrade that housing, because a lot of the residents that live there are in the 30th percentile and below of AMI. They don't have the income really necessary to upkeep the project without some sort of rental assistance. So that is definitely a big, impediment to doing rehab of existing buildings. The state, we want to ensure that everybody stays in their apartment and that they can enjoy it. But then there's also the issue of, well, where's the money going to come from to help support the work that is done. And everybody has got fewer resources in the state, the federal government, the city. So, we're all trying to leverage our dollars as best we can, to reduce the optimal result.
Even in our discussion, obviously, the absence of the 202 program is a huge elephant in the room, and also the recognition that we're not going to build our way out of this problem. So what do we do to fill the gap?
Everybody speak at once.
I do think that we have to maximize what we have already, right? And really take advantage of the services that exist in the community, because this is a service-rich community, but part of the issue is navigating that and accessing services. One of the things that we talked about in the MRT Affordable Housing Work Group is the investment to pay for a service coordinator, resident service advisor, whatever you would want to call it, somebody who helps a senior navigate, this complex system and access services through the Offices for the Aging as well as the Department of Health. Just that investment, if that deferred or prevented nursing home placement for 1 year for one person, it pays for itself. So I think there's actually some simple investments we can make that could have a significant return and really maximize what we have currently.
Stewart as a service provider.
I was going to say, I totally agree with that. I mean, what we have done historically, and we, the community, is to cobble together a bunch of services, whether they come from the Office of Aging, again, DOH or OMH, or the city. We cobble those together and work hard to bring those services to people if and when they need them. The service coordinator clearly is an individual and it follows sort of the mindset of our current environment, which is a managed care environment, so we haven't yet talked about the funding of that. But what managed care has as its core is a care manager or coordinator who is accessing a whole array of services and seeing, in an insurance world where you're looking at the bottom line, seeing how you could use the least costly service to get the most good. Well, we could do the same because, again, when we're cobbling Meals on Wheels and home care and et cetera, all together, maybe there's a more efficient way of doing that. But if we have 3 different care coordinators or case managers from various programs, we have a case manager in the home care program, a case manager in a case management program funded by the city, a case manager from et cetera. Why couldn't we have one who organized all of those services? That would maximize and leverage what we have currently. And to a point that Robin made earlier, all of those services that I just mentioned, and the list that continues after that, are all licensed or certified services.
I think someone's phone is ringing. Not with mine, it's not. So put it on silent if you could. Stuart, you started to touch on this a little bit, sort of in terms of the service model for developing senior housing coupled with services. What are some of the regulatory barriers you see to doing this model with success?
Well, one of the barriers for independent living, and I mean this is discussions clearly at the state level, has been how independent living with services gets very close to being a kissing cousin to assisted living. I mean, there are those in this room who have studied this long and hard, but I think we need to sit together and jointly to figure out a way so that does not remain a barrier. People who are living independently, who don't need services when they move in, whether they're 65 or 75, they've moved in independently of their own volition and may or may not need services. People that move into assisted living sign on day one for an array of services. If those services are, if and when needed, it's efficient and it's totally at the option of the individual who needs those services. I think the current regulations in many ways inhibit the development of assisted living with services, and I think that is something that should be studied at the state level.
Yeah, so this is a really complex issue that we have spent years talking about at Leading Age New York, and I think it's important to note, first of all, that there's a place for every kind of service within the continuum, and I think there's a place for assisted living, for nursing homes. The challenge is, as we try to be a bit more creative and innovative in bringing services into senior housing, we have to have some clarity about what happens, how do you know when you've kind of gone too far. And we certainly don't want to inhibit creativity, particularly in this time of scarce resources. Right now, statutorily, when basically a housing provider cannot provide, arrange, or coordinate home care or personal care services beyond periodic assistance and coordination, and cannot provide 24-hour supervision without starting to kind of trip that licensure line. So I think There actually is a lot that we can do currently within the current regulatory framework. There's still a lot of innovation that can happen here, but I think that we need to continue the discussions that we've had with our members and with other stakeholders in the state to really try to figure out, particularly I think in a managed long-term care world, if any pieces of that need to be clarified or refined to really support the future leading.
Great. So we've heard about the importance, by the way, that was totally my phone. I apologize. That was the timer going off, so you're on time, y'all. I apologize. So we've heard about the importance of data and really supporting evidence-based intervention. So I'd love for maybe start with you, Stuart, and then go across the panel. What do we need to be studying and proving out that there are cost savings when it comes to housing with services? What are the outcomes that you're already seeing from your work? And are there ongoing efforts here in the city that we can point to and lift up, for examples, to policymakers and others that need to be a part of this conversation?
I mean, Dr. Cheryl Phillips, Dr. Stone have both talked a lot about what we are trying to do to hold down costs. Every day in housing with services, we are assisting people to stay out of hospitals, to stay out of the emergency rooms, and to prevent the rehospitalization. So those are the classic measures that we're looking at. However, we do that, as was said earlier, as a plural of anecdotes, or whatever that phrase was that Cheryl Phillips was using. We do that anecdotally. And there are reasons why we have not been able to collect that data to demonstrate those outcomes, which generally, but I was delighted to hear through the MRT, that's beginning to be studied now for the MRT populations as to what those outcomes are. But when we use a social worker to help somebody to make sure that he or she takes their medications after the discharge, so in a care transitions program, for instance, and by taking those medications, very simple question that you would ask your mother or father, but these people may not have children or somebody nearby them. So, did you take the medication? Did you follow up with your physician visit that you were supposed to do, which will stop the relapse? But we're not studying that carefully. The use of technology, how we utilize technology and what its impact. We know that technology has transformed the business industry. Technology has transformed the finance industry. We are toying with it right now in terms of healthcare, and yet there are some very simple, practical technologies that can be used to help people live independently. Study them. There is not money. In our world, the service world, there is not the research and development budget, the R&D budget, so other people would love to bring to this discussion are folks who will help to fund that type of research, because we don't have the research and development. We've got the ideas, we're even implementing them, but again, it's the plurality of the anecdotes, which I intend to now bake into every time I speak. Where is Cheryl still here?
Liz, you've referenced the data collection efforts that are either part or will be part of future MRT deals. Can you want to do that, please?
Sure, and I think this is one of the most exciting pieces of Medicaid redesign, because we have heard time and time again that housing is health, housing saves money, and what we're going to do is we're going to prove it, because we know that supportive housing, costs $50 to $70 per day, costs a few hundred to have someone in a nursing home, a few thousand for an inpatient hospitalization. So what we're going to do with each program and each pilot is to track all of the individuals who receive housing through the MRT. We're going to collect the Medicaid identification numbers, and we're going to run it through the Medicaid data warehouse, and we're going to be able to see what did you cost the Medicaid system 1 or 2 years before you received housing, and what do you cost now? And our goal is to see decreased emergency room use, decreased hospitalization, increase in primary care, and an overall net savings with the goal of reinvesting those savings back into housing. And that data collection has already started. Any service provider or agency that receives funds through the MRT are required to collect the data. And we heard last year, no, don't make us do it. We can't do it. Please, no. We heard that for months and months and months, but we knew the importance of it. And the goal is to not even, not just prove it at the state level, but bring this data to CMS. Because another goal, right now we are using state-only Medicaid dollars to fund the MRT initiatives, and our goal is to grow the source of funding and to prove to our federal partners that it works and it saves money to convince them to get a federal dollar for every state dollar we spend.
Certainly agree with everything that's been said, and I can't wait to see the data that comes out of this and Robin Stone's work. But I think the challenge is that a lot of you are kind of operating on a shoestring. There's just no extra money to do the kind of study that we need to do and really engage the experts necessary to get this data. But I think, too, that it's important to think about the types of interventions that we're talking about can also increase the use of non-Medicaid services like Meals on Wheels, transportation, things of that nature that promote wellness in the aging population, which therefore saves Medicaid dollars. So I think we need to think about that. I also, an aspect of this that I think will not get captured is that I think there's a lot of folks living in affordable housing that are not Medicaid eligible currently, but are just one event away from becoming Medicaid eligible, and that event is usually something that lands them potentially in a nursing home or some high-cost setting. So I think that might be kind of a good future research endeavor for anyone who's interested.
That's actually a great question, great segue into understanding sort of who are sort of what's the unmet need, sort of who are we not touching or reaching with either some of the MRT work or just existing production programs, you reference that population based on your experience and work. Who are we not touching?
Well, I can tell you who we are touching, and you can tell me who I'm missing.
Okay, fair enough.
The Medicaid redesign, it's targeted at high-cost Medicaid users. We haven't defined that because a high-cost Medicaid member changes by the day. We are touching individuals who are homeless, who have mental health, substance abuse, who are physically disabled, developmentally disabled, and seniors. So those are the groups that we're currently reaching. And so, I would be interested to hear what groups we aren't, because I think the good thing about this particular program is, we don't think there's a one solution answer to housing. It's very complex and it's different depending upon the population you're trying to serve.
I guess just to go back to the earlier point about the population that's there that we're not sure, okay, are they one step away from, ending up in the emergency room? There are a lot of people out there that we just don't have that information on. And as we look at the MRT and we look at, a mixed population living in buildings, if you have the services there, they're in the building. They're there, and there may be a person that may not be in that targeted group, but could definitely be helped, by the services in the building, by the fact that there may be a community health facility on the ground floor.
I don't know this to be true, but just thinking of populations and an old saying, which is, why do they rob banks? Because that's where the money is. What Robin Stone talked about before in terms of the housing authorities, we know that population to be low income. We know as a result of low income, they are more predisposed for healthcare needs. And I wonder, what we might be able to do to more closely examine that population in terms of savings to the system. Because again, it's a model of housing and services which are provided at NYCHA properties, but it's a model that lived from yesteryear, and I don't know, so please if there's anybody here from NYCHA, but that's where the large population is, and that's where efficiencies can be recognized, given that they are in a designated area.
Yeah, and I think too, I'll just kind of highlight our paper for a moment, and there's folks in the room who work very hard on that and would be happy to talk to you, but there's a lot of data in there. What it shows too is that, and this is probably no surprise, but there's a growing number of seniors that are living alone. I think that the data was around 30 or 31% in the city right now. So I think if you think about an affordable housing building where there isn't that kind of service coordinator person, and this is a person who's living alone, who is going to kind of catch that sort of decline if they start to become forgetful and disoriented? I mean, I would imagine there's actually a lot of people that are kind of slipping through the cracks just because we don't have some of those simple supports in place.
We've talked about sort of who should be a part of this conversation and supporting housing and services from a policy, from a production, from a preservation perspective. In addition to affordable housing providers and service providers, are there other sectors or leaders, we've mentioned public housing, that need to be at the table as partners in future senior housing development? You've mentioned sort of R&D and academic stage. Are there other partners that we need to be engaging with?
I think the whole infrastructure of government, the governmental agencies at state and city level. Again, the services that we're cobbling together are funded by both. And we have a conference like this to sit as a strategic discussion to think about how we better leverage that. I mean, in addition, of course, the developers and the syndicators and the whole funding side of it, I think needs to be brought to the table as well. But then you have everybody at the table which provide the services and will understand the very simple statement that Diane makes about a coordinator. We amass this huge array of services and funding. We're talking about billions of dollars, but we won't have a coordinator that you have to pay de minimis amount to help coordinate.
Well, I think part of maybe the issue too is who does the coordination, because we've heard that issue, especially with the newly developed health homes, that have been popping up throughout the state. Who's responsible for the care coordination of the member? Is it the service provider, the housing provider? Is it the health home? And I think that we're still trying to work through all of those issues so that we aren't paying for something twice or that we aren't missing a needed service on the ground.
Just say one benefit, that the MRT has had is that you have brought together a lot of stakeholders that usually weren't, speaking to each other. I mean, just within state government, getting one state agency to talk to another, it's not always easy.
Well.
And now you do have all the agencies involved on the program. I think that's a good start.
So the theme of this conference is call to action, and really what I would love, and I think our audience would be happy to hear this too, is sort of what are the 2 or 3 key things that you believe from your perspective need to be on that action agenda with regard to senior housing and older New Yorkers. So I'll start with Diana.
Yeah. Well, I think the most important piece is that we need to continue to invest in supportive services and capital improvements to affordable housing to really maximize our existing stock. and we need to be able to research it and collect data so that we can really demonstrate what we all know is true, and that it will save Medicaid dollars and Medicare dollars. I think that's the most critical piece.
I think data collection to continue the work of the Affordable Housing Work Group and to continue the growth of the program and to engage new partners in the endeavor, CMS, HUD, the city has been a great partner. What kind of new models can we learn from? And I do think that is, the benefit of the Affordable Housing Work Group is we have all of the best minds at the table at every agency and almost, a representative of every group. And I think that's really been beneficial for the program.
Clearly, for me, the coordination of services is primary, but I think too that examining models of co-located services, whether they be senior centers or physician groups or federally qualified health centers, along with groups of housing, because obviously it's inefficient to do that for a 50 or 60 unit building, but along with groups of housing, would be very important to examine, because by doing that, you are making part and parcel of the housing model the availability and accessibility of healthcare services and wellness services. So going from senior centers to FQHCs, you have that whole array of services and are essentially creating the continuum of care for the people to help them to stay living independently where they want to be.
And I guess I would just emphasize the data collection point, because the more information that can be gathered as to the benefits, especially on the financial side, that can be gathered, then the more likely that it moves to the front of the priority list on when it comes to allocating state resources to build or preserve housing. And the state likes to leverage its resources and put them to where they think they can do the most good for the community. And the more data that can be shown that the health and housing there are just beneficial, and that these types of services work really well, and that we should start incorporating them into our housing models, and the more likely that you will see funding for those types of housing partnerships develop.
Any last questions or comments that you'd like to ask your fellow panelists?
Who was the phone call from?
No, that was the timer. That was the timer going on. So, great. So let's thank our panelists today for joining us. New Yorkers like to think we are the center of the world, but New York City is unique, and we have the pleasure of having some of our leaders and really great thinkers around this issue of older New Yorkers and how we might serve them, but also how to continue to support the development and preservation of affordable housing in New York City. So again, I'm not going to read through folks' bios, but I will just say we are really pleased and honored to have Commissioner Lillian Barrios-Paoli join us this morning, as well as Assistant Commissioner of Special Needs Housing of New York City HPD, Jessica Katz, David Gilchrist, the Executive Director of Project Fine, and Geraldine Perrine, former HPD Commissioner and now Executive Director of the Citizens Housing and Planning Council. So let's welcome them all. We're going to follow this again in terms of, I'm going to ask each panelist to open up with a 2-minute statement about the affordable housing agenda for older New Yorkers from their perspective. And without further ado, we'll start with Commissioner Lillian Barrios-Paoli.
I guess it's age before beauty.
Not such an hour.
Okay.
Okay, so I think we've heard a lot of things already, and I think you've heard about the issues of affordability in the city. And for seniors, affordability is number one. I think we have a housing subsidy for renters, screen, that is very useful, but not enough. Not enough people that are eligible to receive it. The threshold for the income is much too low. There are any number of things that I think SCREET needs to be seriously looked at as a real resource. But there are other areas of subsidy for housing that seniors should be able to have, and maybe we need to create other new ones. There's the issue of supportive services. I think we have great models in the Aging in Place initiatives in the city, in the North initiatives, the idea that we bring services to the housing development that seniors live in, or the buildings that seniors live in, not the seniors to the services, which is a lot more difficult and costly and so on. And we need to refine those models. We need to put more money in those models. We need to think more creatively about the relationships around those models. The more I stay in government and in not-for-profits, I think the number one enemy of any kind of creative thinking and creative service is categorical funding. And that's why I think, when we were listening to the prior presenters, the idea that everybody has, if they only have one or two problems, they have at least 3 or 4 casework. If they have more than 3 problems, then they have 4 or 5. And the coordination of those services become very difficult because everybody's looking at the elephant from one angle. How do we redefine funding and funding streams and services so that there is one person in charge of that particular senior, that particular client that has a need? There's the issue of neighborhoods needing to be more friendly. We've addressed some of that with the age-friendly initiatives. But neighborhoods can be quite unfriendly. We've begun to put more benches so that people can sit and rest if they go to the supermarket and they have 3 blocks between the river. There's always a river between the river and wherever they are. But we need to make sidewalks easier. Bathrooms. If those of you of a certain age know that bathrooms become obsessive, and there's New York is not a user-friendly bathroom place. Water. Dwayne Reed now in the West Side allows you to use the bathroom, have a glass of water, and sit. Those things that seem to be so weird if you're under 40, but not so weird if you're over. So, just making the neighborhood a more supportive place. People looking out for each other. We saw that during Sandy. There were a lot of people in high-risers that nobody knew were in need just because nobody had a relationship with them. I'm guilty as charged. I live in a fairly large building, and I take pains not to make eye contact with my neighbors. I think it's a function of too many people in one place. But still, the reality is that we have to be more accountable for each other, particularly people aging and people who are frail in our own buildings. So all of these things are things that need to be addressed. We have 1/3 of our seniors are poor according to the new poverty measures. People are living longer and being more frail. So we have an aging city, and we have to sort of change our culture towards aging and the way we look at people who age around us and ourselves.
Thank you, Commissioner. Jessica Katz?
Hey, everybody. Thank you so much for having me here. Move this mic up a little. So I want to tell a little story about the housing development journey over the last 10 years with senior housing development. So we started out with the HUD 202 program. Everyone remember the HUD 202 program? And in New York City, even the HUD 202 program, as fantastic as it was, really wasn't enough to fund the full cost of developing housing in a high-cost area like New York. So the city decided to invent a gap financing program for HUD 202. So we had somewhere between $6 and $10 million a year that we were using to fund the gap in HUD 202s so we could continue on leveraging as much of that federal funding as we could. Then Congress zeroed out budget for HUD 202, and we thought we were stuck, but we have this money in our budget still on the city side. So we decided to kind of proactively create almost like a synthetic HUD 202 program where we use tax-exempt bonds, private debt, and some of the federal money that we still had in our budget, along with some project-based vouchers from NYCHA, who has been a tremendous partner in this, and I don't get nearly enough credit on this score, to create, sort of, to replicate the HUD 202 program in the absence of HUD. Then sequestration hit, and our Section 8 program was ground to a halt. So now we can't even do those projects anymore. But we still had some construction going. We do about 300 or 400 units a year of senior housing. And then today's new development is that because of the government shutdown, we can't even fund the workers on construction sites for projects, senior housing projects that are in construction right now. So that hopefully will be a very short-term problem, but we've taken a lot of hits over the last 10 years. I don't know if it's all bad news, though. I think some of us do our best work when we're backed into a corner. So hopefully we can use this moment to get a little bit creative. I think some of the main programs that we want to think about going forward are, I can't stress enough the importance of rental systems and figuring out an interesting way to use rental assistance. It's the only way to do senior housing, really. There could be some zoning changes that could help enable the private market to do affordable housing for seniors, as well as some of the nonprofits who have been doing this work, just to make it a little bit easier, a little bit more affordable. And then we've heard a lot about the MRT program, which is kind of our last best hope right now, and capital and rental assistance dollars for senior housing. And then when there started to be the scare around the federal budget, we sort of dropped this, but something that Enterprise has been really a leader in is talking about how to use the tax credit program to not focus so exclusively on people at 60% of median income, and maybe broaden that a little bit. Sometimes it's called the 30-60-90 model, where you can go get a little bit of deeper affordability for lower income people in exchange for going a little bit higher, and then we can fund a kind of broader diversity of income levels in affordable housing, and that could be a huge, huge benefit, in particular to seniors in the city.
Thank you, Jessica. David Gilchrist, Executive Director of Project Line.
Hi, I'd like to thank the organizers of today's symposium for bringing us together for this important conversation about aging in place and the housing needs of older adults. Project Find provides nearly 600 units of publicly assisted housing with integrated social services. Our buildings provide housing for people coming out of the shelter system, as well as individuals who are very low and low income. We also operate 4 senior centers funded by the Department for the Aging, 3 of which are integrated within the buildings that attract over 750 people every day. From my experience, I've seen what everybody's been alluding to as a poverty problem and a supply problem, particularly at the lowest rungs of the economic ladder. And I've also seen the efficacy of a housing model that provides a stable basis for the long-term independency of its tenancy. As Lillian mentioned, there's around 270,000 seniors that are living at or below the poverty line, which is $15,000 for a couple. The supply of affordable housing is shrinking. A recent study of the rental housing market showed that out of 2.1 million units, only 18% of them were affordable to households earning 50% of the area median income. Our wait lists at Project Find are overwhelmingly represented by individuals who cannot afford to live in our buildings. I looked at the wait list stats for the last year, and over 50% of the people were at around $16,000 a year or less, could only afford an apartment at $500 more or less per year. If these trends are left unaddressed, we're going to see a growing number of older adults that are marginally housed, anxiously housed, or really at risk of becoming homeless, with marked long-term consequences for their physical health and their mental well-being. So I'm really hoping that from this symposium, this conference, emerges a really a broad-based advocacy agenda around rental support, housing production, and a real effort to analyze sort of the life circumstances and the housing predicament of particularly those at the lowest end of the economic spectrum. Thank you.
Thank you, David. Geraldine Green, Executive Director of CHPC.
Thanks, Shola. I guess, when I thought about what to say here at the beginning, I will paraphrase my old friend Nancy Waxstein, who had a recent discussion about Preventing Homelessness said, you know, we know what to do, we just don't do it. And I think, you know, for me, that's really what this is about. I mean, you know, we know what to do, we just don't do it. So we've got, you know, the city working very hard, and out comes, you know, 300-400 units for low-income seniors. We have the state on the panel before, you know, very nice, everybody working very hard, statewide, 5,000 units. In New York City, we have 1 million people over the age of 65. So, you know, those numbers are, you know, just kind of an embarrassment, not in any way. I mean, the work of these people is extraordinary. It's just that you can't do it this way, right? So it just simply doesn't work. Of those 1 million seniors in New York, over 65, you know, 2/3 live within a household where somebody else is the head of household. So, you know, a lot of seniors are living within families or in some kind of a household situation. And presumably, those are people that can be also supported there, right? Like, everybody doesn't have to end up with their very own apartment someplace else. You've got another 1/3 who are the head of household. And of those, ironically, 50% are actually overhoused. And this very much adds to the affordability problem. So they're overhoused. They're living in 2 bedrooms or bigger. Now, the historical thinking about this, and God knows I was at HPD when they tried the famous get the old ladies to move out of the 3-bedroom apartments in Mitchell-Loma. Oh my God. I mean, forget it. You know, you might as well, I don't know what Sisyphus task you can even equate with that process. But, it's pointless. But, you know, and everybody always brings this up. They bring it up in terms of the housing authority. And, you know, but in our work at CHBC, we've launched a project called Making Room, where we've really looked at the underground housing market and the need for creating more housing for single people, both single people to live alone, to share with others, and to be able to be part of an adapted household in an extended family. And so, you know, I mean, I know Airbnb is under attack these days, but why not Airbnb for seniors? I mean, why can't they rent that extra room? And I say this with all seriousness, and why not let them keep the freaking money? Okay, so they make a little money. I mean, I don't know, is this really the end of civilization as we know it? You know, we have the Attorney General suing people now over this, that they should, you know, be reporting their taxes, whatever. But, you know, I think that there's ways, if we think about our existing housing stock, we're never going to build enough housing for this population. It's just not going to happen. But I would also say to all of you, and the title up here, if you just remove the word senior from the housing piece, probably none of you have testified against parking regulations in the zoning resolution, or spoken up against, you know, the problems of not being able to convert a 1-family to a 2-family without adding another parking pad in New York City. Why? We have subways, we have mass transit, you don't need parking everywhere. All of these things add to the cost of housing, and so they're going to add to this cost of housing too. So you have to, I hope that you'll step a little bit out of the silo of focusing on seniors and think about anything that's bad for the creation of new housing is going to be bad for this population too. So you have to start to sort of add your voices to that as well.
Thank you. So again, we're going to use this format of just some questions and hopefully a conversation with our panelists this morning. Can everyone hear me? Okay. There's been this theme around the importance of data. So I'd like actually for us to start with, what do we know? The demand that you've read, David and Geraldine referenced the statistics that tell us that the demand for senior housing far outstrips our ability to keep up with the production. So there's a preservation strategy here. So A, what can be done to help seniors age in place? And then 2, what are some best practices either from New York City, around the country, or the globe that we should be looking to? And so I will start with Commissioner.
So I think that there's several issues around this. I mean, I think that seniors that live in a building that has an elevator are probably okay, and you can bring services. But there's a lot of seniors who are walk-ups that they can no longer really negotiate. So they're virtually trapped in a third or fourth floor walk-up. There are a number of people that we serve Meals on Wheels on, for, and it's not that they couldn't do for themselves, but they can't shop. They can't, they may be able to cook, but they can't shop and go 4 floors every other day. So if they need to move to a place that is much more user-friendly for them, and that apartment may be open for a younger person. So I think we have to sort of look at that, sort of that need that is created. A lot of the senior needs is that they need to leave the place they're in to a more user-friendly place. And that place should not be a nursing home. And that's usually what ends up happening, that there's no affordable apartment that meets the need, and then they end up in a nursing home, and they really don't need the nursing home at that point in their life. So that's a really crucial thing that we see all the time, and I think that's a very, it's a tremendous need. There's also the affordability part. I mean, there's no question about it. I mean, the way we've defined street, there's a lot of people who need rental assistance that just don't qualify. And they just don't have enough money to afford an apartment in the city. That's the bottom line. And then again, the last resort is ended up in institutional care, which is much more expensive. So we need to look at that.
Well, I was going to say that's a really good point about just sort of the mismatch between sort of being able to walk upstairs or being in an elevator, being on a low floor. And we've spent the last 50 years in housing policy essentially eradicating small apartments. And we've done that both through, eradicating the stocks of housing like SROs, like the old, single-sex hotels, like a building that I came across the other day that still has a CMO called a bachelor apartment, where you'd rent a room in a small building and the landlady would maybe wash your sheets and towels and you didn't have a kitchen and you'd maybe eat with her. So all of these things have been eradicated over the last 50 years, but we haven't substituted anything for it, right? So we just kind of expected everybody to, marry somebody with a lot of money and then have kids and, end up happily somewhere. But we weren't thinking that people were going to end up on the 3rd floor, the 4th floor, and not be able to get down. We're battling now, actually, HPD is battling a little bit in the city council with moving their micro-unit apartment. We've got a standard of 400 square foot as a minimum. That's palatial by a lot of countries and a lot of places. And, people buy a bundle of housing. They want to live in a community. They want to be part of that community. That same person who's trapped just because of stairs, if that person was in a smaller space but on a ground floor, they could become part of that community. And surely that's more valuable than, having a greater space. These things are doable. This is not like building the Space Shuttle Columbia, which also was doable. But we could do these things if we thought about communities and thought about the resources within the community and thought about not so much, I guess you're service people, I'm not, so I think about a community being a place that enriches people's public life, right, and their civic engagement. And if you thought about that experience and what could we do for seniors to enhance that, the first step surely is getting down the stairs.
Yeah, I think it's a real shame of all these things that we don't do, because in so many ways New York City is an amazing place to live when you're aging, right? I get my food delivered, I get my prescriptions delivered, I get my laundry delivered already. Some of these kind of anecdotal things that we think of people aging in other places, like I can't really clean my gutters and mow my lawn anymore, I can't drive anymore, we don't have some of those issues for the most part. So making New York an even better place for people to age where they are, it's unconscionable if we don't do that. We get thousands and thousands of applications every time we do a lottery for HUD 202, but I'm guessing for the most part, the reason why people want to move into that building is not because the building is so great, although many of them are lovely. It's because the building is an elevator and you're not paying more than 30% of your income. I think if you could solve that problem for people where they live, then you wouldn't have this flood of applications every single time.
Right. Well, people have pretty much touched on things, but the natural occurring retirement community is another model. So if there are geographically concentrated complexes where people are aging, that is a very efficient model that has the intimacy of scale and familiarity, where sort of organic, peer-based supports can emerge. That opportunity should always be taken advantage of. And I think that the age-friendly initiative that the New York City was a part of about 3 or 4 years ago is a great planning framework to start thinking about a whole raft of services that affect the nature and tenor of the community as it relates specifically to older adults. And that's where things came out about more benches, changing accessory, working on publicizing where the bathrooms are and things of that sort. But it's sort of a planning framework that always puts the life circumstance of the senior in the forefront. And that was a very, I think, a great planning framework that's been undertaken.
David, I'm going to stick with you for a second and ask you to speak a little bit about sort of any special solutions we need to be thinking about for the highest need, most vulnerable populations within the sort of older New Yorkers. What special preservation policy, production ideas should you be thinking about with regard to the population that you serve?
Well, it's a whole gamut. I saw a study which showed that there were roughly 90,000 seniors paying over 50% of their income towards rent. And this is a group that's really, they are very close to being homeless at any given moment. It begs for further study. Perhaps what's required is income support or eviction prevention or rental support, the type that keep them housed where they are or to enable them to move somewhere else. Expanding the supply is also always a necessary consideration. In the past 10 years, HPD has preserved and produced 165,000 units, more or less, with the preservation being, 125,000. But an enormous investment. There's a blueprint out there for housing right now of 190,000. It's not that resources aren't being committed and fought through. I just don't see where they deeply connect with seniors as being potential beneficiaries of some of this new production in particular.
What about the city's efforts there? Yeah, so I think part of there has been, in addition to the new construction that I already talked about, David's right, there's a lot of preservation of older senior housing projects that we've spent a tremendous amount of resources between HPD and HTC on. But just to flesh out my conversation about rental assistance a little bit more, all of our units that HPD produces are eligible and available to senior citizens. The reason why they may not be quite so useful for senior citizens is the rental assistance problem. So many of our units, just as an example, are targeted for people at 60% of area median income. So the band would be, in order to qualify for a unit, if you're a single adult, you have to be making between $34,314 to $36,120. So leave aside the fact that that's fairly high for a senior citizen, or particularly the ones that we are most concerned about finding housing for, that's an $1,800 band. So you need to find people who are within that income band, the $1,800 gap, and are 65 and over. And most often we try to create a community preference, and we want seniors to be able to, in particular, to be able to live in the communities that they know of and have social contacts in. So now you're kind of shrinking the pool of who's eligible. So now it now becomes a challenge to make sure that those units are really targeted towards seniors. Even though we'd like, for the most part, for seniors to be taking advantage of our generic affordable housing stock and not necessarily only to the 300-400 units that we do that are specifically targeted for seniors. But when you have rental assistance in the mix, now I can market to people who are making anywhere between $0 a year and $36,000 a year. So it really broadens the scope and it creates a lot more opportunities for people who are on fixed income. So it makes a big difference.
Yeah, and if I can just follow up on the need for rental and importance of rental assistance. If you, and I recommend that you all do look at the work of Mark Levitan that's coming out of the Center for Economic Opportunity out of the Mayor's office. And, because Mark has really been the person who sort of created this new measure of poverty. But the interesting thing is he's built it up a lot around what people pay for housing and what benefits they receive for housing. And one of the really important things in his work, which I feel like has just not been paid enough attention to, is that the kind of housing assistance that really keeps people out of poverty, just keeps their heads up above poverty, are means-tested assistance. So that means Section 8 rental assistance, or he doesn't specifically mention screen, but a screen-like assistance, and public housing. In the case of both Section 8 and public housing, these are exactly the programs that are, dying of 1,000 cuts right now. So with no real, a kind of gloomy future, right? I mean, I don't think anybody thinks there's going to be a big expansion for funding for either of these programs. These are the programs that keep people out of poverty, and that would provide huge help for seniors and for anybody else. And so again, if you care about this population, you have to start looking a little bit beyond just this population and try to kind of add your voice to other advocacy voices that are working on those issues, because these programs are going down the tubes right now.
And I do think that we have not been as creative as we could have been in terms of using existing funding streams to provide rental assistance. I think TANF is an area where we could have used it and should have used it and hopefully will use it in a more creative way to provide that. Taking people out of poverty, as Geraldine pointed out, it's not brain surgery. I mean, there's things that really impoverish families, seniors, and everybody else. And most of it in New York City is housing and, medical costs, which hopefully will get addressed in some other way, but if they allow it. But the reality is that TANF is a funding stream designed in many ways to support people that have no income, but in many ways to support working families, the working poor. And the working poor are poor in many instances because they need help with their housing and the rental assistance that they have. So I think it would help homelessness immensely. I think, there are many reasons why people are homeless, but for families, a lot of it is just lack of housing. Not everybody who's a homeless family necessitates a social worker attached to them. And I think that has been a tremendous overkill. But I think that we have to be more creative with the money that we do have and sort of stretch the limits a little more. And I'm hopeful that, that's one of the areas that we start looking at. There's a lot of tax levy money that currently is going for homelessness that, may be better applied in other ways. Not to say that we don't have to shelter the homeless, we do. But there are other ways that we can do more prevention, quite honestly. And I think home-based worked. And I think, we have to look at those kinds of interventions. I mean, rental assistance was working. I mean, I don't know that exactly everything around it worked, but the idea was good.
Well, we heard from our state colleagues this morning about the work with regard to the MRT and utilizing those resources as part of affordable housing justice. But could you talk a little bit about how the city is going to, or is, leveraging existing state programs and resources and what you'd like to see more of?
Sure. So we've been, DOH and all the folks on the MRT Affordable Housing Work Group have been a really great partner to us, and about half of the projects that we did in the special needs unit this year, we doubled production. We went from about 500 units a year to 1,000, and most of that is thanks to leveraging state money in the form of capital from HFA, in the form of rental assistance through the MRT program, as well as capital from MRT. So that's been a great partnership, but really didn't exist before. So that's been pretty new in the last few years that we would jointly fund projects that way. So that's been really fantastic. I think what we need to see going forward is kind of a move towards a real long-term plan. We're kind of winding down the plan that we have, and it's perfect timing on the city side to come up with a big new vision. This year, in the special needs housing division, I have $100 million in capital. I'm very, very lucky. I have a ton of money available to spend. What I'm lacking in order to be able to spend that money is rental assistance and social service funding. So it would be a real shame if, I've had really great leadership at my agency and at City Hall, kind of pumping us full of capital dollars to make housing happen. And if we can't make it available to the people who need it the most, then that'll be a real waste.
It sounds like part of that action agenda is rental assistance and social service
Yeah.
coordination. Okay, great. Any response to that or those comments?
Yeah, I think too, just on these last 2 points, I mean, one of the things we can think about how to use resources smarter, and I think people have touched on it today, is just think about the neighborhood. I mean, we don't have, there is nobody that comes to work to make East New York better. It's all sort of siloed for different topics and different things. It's true in government, not-for-profit. I mean, it's sort of across the board. And we still have some of what I think of as the traditional sort of settlement house ideas and those kinds of models operating in some communities. But I think we have to really get back to a community-based approach. We could save money. I mean, if you looked at all the government money on the service side that's going into a particular community, it's, I'm sure, more enormous than it feels like comes out the other end in useful help, right? So, I mean, if there are some ways to really get back to the basics, like community-based approaches, and have people step out of their siloed views a little bit. I think HPD's work is probably the closest in city government, but also what Lillian does in neighborhoods, with providing services in a community-based way. But we've got to break down the silos, and it's not just for seniors, it's not just for homeless, it's not just for this, it's for that, and it's just also for the person who's confused about what to do with their cable bill. I mean, I know this from this is what I help my next door neighbor with, and he just gets flummoxed with things. And so we're there, so we help him, but he's by himself. And if we weren't there and he was living in a different kind of a setting, where would he go? He doesn't really need, he doesn't need, psychiatric social workers. He just needs somebody, as we probably all do, to interpret our cable bill. So if there was more of a neighborhood-based approach, I think we could save money and put it into the things that really you need the government money to go to, like providing housing and services for the most needy people.
So let's talk a little bit more about the sort of community level approach to affordable housing. Sandy clearly highlighted some of the gaps in how we operate as a city, but certainly also how we deal and address this particular population. What lessons did we learn? I'll start with the commissioner. And what are the lessons and what are the sort of specific things we can learn from that and take it forward for the next administration?
So, several things. I mean, the most important thing is why in the name of God would anybody think that it was a good idea to put 1 billion seniors in the Rockaways with no communication? Where did that come from? I don't know. That being said, I think one of the most important lessons that we learned is that there were, the seniors that we knew we could take care of, there were a large number of seniors that could function extremely well if they lived on the 13th floor of a place like Stuyvesant Town, but when there were no elevators, they were totally isolated and nobody knew about them, except a daughter in Boston who called us to see if we could look up on their mom. So some way of either the landlord or the neighbors knowing who's vulnerable. So if there's a blackout, if there's whatever catastrophe occurs, that we know who are the people that should be looked upon, because they're going to get in serious trouble within the next 24 hours if somebody doesn't. One example of something working really, really, really well happened at Knickerbocker Village in the Lower East Side, where the landlord, there's a north there with Hamilton Madison House, and the landlord reached out to them, and they worked together, and they knew exactly where every senior was. They brought food and water and everything else to everybody every day. They got their meds to them, and they were like more than 2 weeks without any power. And, we worked with them. We brought we brought resources to them as well. But it was that partnership between the North and the management company that really, really worked. And a very sensitive, obviously, management company that cared about doing this. But, we got them a generator. They knew what the needs were. And it's really an incredibly good example of an aging in place initiative in North that really knew their population and the housing that have already a relationship with them.
Yeah, and I guess I would just, again, going back to my friend Nancy Waxstein's quote, these weren't lessons of Hurricane Sandy. I mean, these were lessons of the heat wave in Boston in 1995 when 650 mostly seniors died, Chicago, died. And if you read Eric Kleinenberg's book, Heat Wave, I mean, it's the same thing. If you substituted hurricane for heat wave, I mean, it was the same. People died because they were lonely. Right? They didn't die, it had nothing to do with you had a fan or you didn't have a fan, or nothing to do with that. No one knew they were there, and they had no one to talk to, and so they died. And that's what you just see over and over again. And why we don't seem to get this, is I don't know why. I can't explain it. I'm not a social scientist in this, but there has to be a better way to sort of connect up what we know about people and just that human, knock on the door. I mean, I do think somebody this morning, though, did talk about, technology, and it's just something I know very little about, although I'm sitting here impressing you with an iPad. It's just for show. So there should be a way to have some kind of use of technology to keep in contact with people, right? Or at least know where they are and know what they might need in an emergency.
Well, I would say that the senior centers that the Department of the Aging funds there's 240 of them, 48 throughout the city, and these are sort of like natural touch points for many older adults in those communities, and they can be a place where that types of information can get transmitted out. They're often not adequately funded enough to be able to do community-based social work, but they are a pre-existing resource that's kind of pump-primed to do something of that sort if and when the need arises.
I think that we at HB tend to focus a lot, obviously, on bricks and mortar, and I've been asked a million times a day how many units am I building this year, but there's not a lot of other metrics that we're judged on. So we're trying to move towards a more kind of holistic neighborhood-based concept. So right now, an example from supportive housing, there's an RFQ out for city-owned properties for supportive housing. So we do ask about how much you spent the last time you did a project. We talk about your community support, but one thing we really wanted to focus on is how good a neighbor are you for the buildings that you currently have? So not just how do you engage the community so that I don't take the political heat when a project gets controversial, but when that storm is passed, when you're in the community and you have staff on site and you have 24-hour front desk, what are you doing to engage the community and not just take care of the tenants in your own building? So how can we measure something like a Knickerbocker Village where the management company really stepped up and took care of people, or a nonprofit that uses their community room not just for the birthday party in their own building, but also for the community board to come in so people kind of know who you are and you can be a center of neighborhood support during a difficult time.
Geraldine, you've spoken quite eloquently about how our built environment is either helping or not the changing or addressing the changing demographics of our population. You all hopefully have seen the the museum of the City of New York exhibit called Making Room and the great work that you're doing there. Can you just sort of talk to us about what you've learned with regard to the regulatory obstacles that we need to address that help us address the way we live now?
Well, maybe the saddest thing I learned is that so few people even understand how that regulatory envelope is shaping how everyone of you lives right now. And so there was a real need for some education of even, dare I say it, like the architectural community, which seemed to be oblivious to this fact. So our rules have grown up over, again, in robustness over the last 50 years. And they've really followed sort of what we think of the values of our mainstream society. So, in 1940, when census data would be collected in housing, people were defined as households, and everybody that lived in that household would be listed and articulated. All of a sudden in 1950, it begins to be defined in terms of family and non-family. So it's sort of like an interesting thing, like, well, where'd that come from, right? So before then, maybe, you had 5 people living together, and maybe they had some loose family relationships, or maybe not, and that was okay, and nobody thought that that was bad. All of a sudden, that becomes bad. So we've now got rules that say in New York, no more than 3 unrelated adults can live together. And, usually when I would say that in an audience, somebody in the audience would always go, because they were, living that way, as many people do. But if you think about that for a moment, and you think about that in relation to seniors, well, what would be so bad about 3 seniors with a live-in cook person who was sort of there to help them, and that it's not a home, and they don't, there's nothing wrong with them. They're just pooling their resources and living together. Is that the end of civilization somehow, or buildings going to collapse, or whatnot? So, I think we have to help to stop demonizing, particularly single adults. When you add the word senior, it becomes like, seniors, okay, and that becomes much nicer. If you don't add the word senior to the word adult, single adult, it's like, oh my God. So all the rules are really about the, oh my God, we don't want building, we don't want small units, we don't want people sharing. We don't want to make it easier for the Bangladeshi family in Queens to legalize their basement apartment for an extended family member or members. So all of those things are just in our regulatory envelope. We can change them. It's like we've met the enemy and they are us. We don't have to blame the federal government or the state. These are almost all local rules. There's some overlap with state rules, but pretty much you're talking about zoning. To some degree, you're talking about building code and the multiple dwelling law, but it's largely a zoning question. And I think, HPD proved that with their experiment with their micro-unit building, where they just gave a little regulatory relief from the zoning resolution and got, huge response, and the thing hasn't even been approved, let alone start construction. And I know I saw somebody at HPD who said, 20 people a day are calling us, for apartments. So we should look at those things and think about, well, does this help or hinder housing seniors? And if it helps seniors move out of those bigger apartments into something more manageable, don't forget, there's a family that needs that apartment, right? So it's a single system. If we can create more movement in that system, it's going to be better. And if we can let people share humanely, legally, safely, these are all things that actually work in a place like New York, because it's already happening in the underground housing market. Go on Craigslist. People are doing this by themselves every day. But we would like it to be done legally, safely, not hidden and not in a situation where people can get exploited. We could do that. Wouldn't cost anything either.
I completely agree with Gerald, and I think that, whenever we want to experiment with different living arrangements, there's always all these things that prevent it from happening. And it would help students. We know that students live in bigger apartments and share, and, it's not really illegal, but they're doing it because they have to. And I think seniors are in the same situation. I think that we have to, it's sort of a matter of looking at what are the regulations that prevent things from happening. What are the things that happen in funding streams that prevent them from being rational? I mean, I have categorical funding too, right? So I have, senior center funding, I have case management funding, I have NORC funding. I have agencies that have all of the above, and their staffs don't talk to each other. They all function in a siloed way. Not because they don't get the rationality of doing it together, but because I measure them in such a way that if they were to blend, would kill them. So, all of these things have to be looked at. Because that's where, we should have senior centers in places where you have 202s so that there's services there for the seniors. But, there are 202 regulations that don't permit certain things from happening. So there are all these things, not, that just, we're doing it to ourselves. I agree with Geraldine. I mean, we just have done, and then we don't check anything. The other things that we just accumulate rules, and we don't go back and see if they still make any sense. So, it's like the woman that used to cut the 2 pieces of the pot roast and put it in the pot because she didn't have a pot big enough. But the daughter has a big pot and she still cuts the 2 ends of the pot roast because that's what the recipe said. So we're still doing that.
Yeah, I mean, I think we do, we in my unit, of course, we make things very easy for developers, but in some cases, we really torture you guys, and then much less if you want to say, okay, I want to build an HPD project with a DIPTA senior center on the first floor, an ACS daycare. There's a few enterprising folks who are willing to beat their head against the wall and make that happen, but for the most part, we make it double the work and then some, because now you have to coordinate amongst us. So I think we've created programs that work really well on their own, but that don't necessarily play very well with one another at times.
David, you experienced this as a developer and owner of affordable housing. What are some of specific recommendations that you would suggest with regard to regulatory issues?
Well, I'm not a developer anymore of publicly assisted housing because of a panoply of problems, namely the complexity of funding, the geographic restrictions in my agency in one of the most highest land price areas in the world. So I've been stymied. What would be beautiful to have is a streamlined funding mechanism which came with rental support and support a senior center or something, or allow me to be connected close to a senior center. But that's the kind of funding that would be necessary.
So we have an election in a little less than 30 days from now, and I'd love to ask folks, with regard to no regard to the candidate, what would be your 2 or 3 recommendations to the next mayor for his, it will be him, within his first 100 days with regard to the preservation and production of affordable housing, or the regulatory issues that we talked about? And I'll start with David.
Well, from what I understand, Joe Lota has embraced the Housing First platform, which calls for the preservation of 90,000 units and the construction of around 60,000 units, using a variety of different mechanisms, from inclusionary zoning to changing tax incentive procedures, use of city-owned property, also affecting things with the housing authority. Bill de Blasio has an expanded version which will call for, I believe, the age of 105,000 new units and preservation of around 85 or so. And he has an even more elaborated way of generating new resources and more expansive thinking. It also includes some of the stuff that Gerald was talking about is fixing up single-family homes to make them habitable, some granny flats. So he is from a housing background, and I think that his platform is more robust and energetic. It does not contain really a formal place for housing targeted for older adults, but it is a more robust plan.
Again, this is not necessarily either candidate, it's more what your priorities would be with regard to housing older adults.
Well, the first thing I would actually say is, please don't come out with a plan that says some number at the end. Because this is, I refer to this as like, I would like a pony, like, yeah, I'd like 200,000 units, but, what problem are you solving? So I think, we've got to start solving problems, not just building up a litany of how many units we've created. That's very nice, but did you fix Brownsville? Did you fix Marsania? Did you do something for, we have more people in the homeless shelters than we've ever had before. So, there's a whole litany of problems. So I think a housing strategy and a housing policy should be focused on outcomes that solve problems, not, it's not a ticker tape of, how many units are created. So if senior housing is a priority, then all housing is a priority. This is a subset of that. And you're going to have to look at the communities most in need and figure out what needs to be done to make those communities places that will support and nurture people and link them up into a vibrant civic public life.
I'll ask our two existing city folks to just talk about what you're excited about that you've been able to do in your tenure that you'd like to see continue in the next administration.
Just 1 second. I think that rental subsidies is a really crucial question, and I would say to the next mayor, look at all the funding streams that can be used for that purpose, and look at the working poor and the homeless families and see how that subsidy could be given to them so that you could encourage the private landlords to make these units available to them and begin to solve the issue. But I think for anyone in New York that makes less than a certain amount of money, rental subsidies are a must. Otherwise, you can't exist. And it's sort of, just as we have public education and we have a number of support systems for people, housing, I think that rental subsidies have to become part of that repertoire. DIFTA has nothing to do with housing, if you could imagine that, senior or otherwise. I think what we've tried to do is create supports in the community for the seniors. I think we've tried to look at the services that we do have. And I agree with David, senior centers are not adequately funded. But no social service is adequately funded. We're funding 80% of the services on a good day, and then you people go and fundraise 20% and subsidize us. That's the reality. And it's a great partnership, right? We get all the glory, you do all the work. But we get adapted to that. But the reality is that we've tried to look at the model of the senior center, we've tried to look at the new aging, we've tried to include more health and more activities in it. And I think together we've created a really viable model. And the Innovative Senior Center, not a great name, but it is, was a model that was created with a partnership with CSCS. DIFTA didn't get up one morning and dream it, actually Bobby Sackman did. But we essentially have created a good collaborative model. I think we've looked at every service and tried to make it more rational. It's not done totally. There's a lot that remains to be done, so hopefully the next administration will continue in that vein. I think the single most important lesson was that we collaborate with the providers, with the advocates, with everybody, and it was a communal work. It wasn't just one person or one group just coming up with all the solutions.
I think having the kind of big banner plan with a number attached to it, I think from inside city government, that actually is helpful and kind of inspiring and energizing to be working towards that. But it doesn't have to be a number of units, right, that you're focusing on. I think we've done a great job at kind of focusing on metrics, and I think that's really entrenched in all the city agencies at this point, is looking at performance and looking at outcomes. It's probably time to take a look to see if the outcomes that we've been measuring are the ones that we care about the most deeply, whether it's only number of units or whether there's something else that we want to look at. So that's sort of the broad, big picture, kind of inspirational side. I do think that there's some work that it will be more boring but perhaps have more impact on our communities and on the city as a whole of the kind of the zoning issues, the paperwork reduction stuff. Let's look at the 20,000 different ways that we torture all of you when you try to develop a senior center or build a housing project or get a building permit, and kind of work towards streamlining some of those bottlenecks in a way that does help us use our existing resources more usefully, because I don't see the 202 program coming back in full force. I don't see the Section 8 program coming back in full force. So I'm going to continue to make that speech a few more times, but at some point we're going to have to sit down and figure out how to use existing resources. And there's 20 ways that we are wasting everybody's time and energy in the room when we try to build these amazing projects. So I think the focus on that will be, it's not going to be the banner press conference. It's not going to be the gold-plated shovel, but I think it could potentially have a greater impact in the long run.
Any questions for your fellow panelists? Well, let's thank our city panelists. I just wanted to tease out a couple of things that we spoke about today, and hopefully if we've missed anything, you all will hear from you in some way to ensure that we're really getting at the issues. But I think the big issue is data across the board, both to prove out the outcomes of the importance of housing and housing plus services. Really excited to see some data collection efforts with regard to at the MRT levels. Here in the city, Jessica and her shop really thinking about outcomes and how and additional ways beyond just units that the city is looking at, how they measure success. And then also the importance for resources to support the R&D activities that are happening in your out in the field. And so that's a tremendous, and I think that ties to connecting to other partners like academic institutions, like our host here, to really help build out a data platform and to help support continued investment in this type of housing for this population. I think the other thing, it's a drumbeat. And again, I think Geraldine told us to get out of our silos. Rental assistance, rental assistance, rental assistance. However we choose to, whatever we choose to call it, if we don't like the term voucher or whatever, the real importance for us to think about utilizing existing resources and deploying them differently to support poor and working families, working individuals to age in place and to have the housing that they need. Third is a variety of regulatory issues that we should be thinking about, and it sounds like there's probably a work group that you already are leading, Bobby, around these things with regard to how we are currently managing our own building envelope that prevent us either from keeping people from aging in place successfully or from supporting their transition to other spaces. And then I think the fourth and most important thing, and I think today is a testament to that, is partnerships and the importance of public-private partnerships. Our federal government is what it is right now, and you all will do whatever you will do as private citizens to engage with that. But we are fortunate here in New York State to have leadership both at the state and city level that are engaged in this issue. But there really needs to be a partnership between the public and private sector to ensure that the connection between housing and healthcare, housing with services, is one that is not just a sort of separate conversation that's happening, but really is one that's integrated. So I may have missed a few things, but I think those are the sort of four sort of big buckets that I heard and that our panelists were gracious enough to share with us. Oh, fifth is coordination of services. Sorry, that's a lot. Coordination of services. My colleagues would be yelling at me to make sure I threw that in. Coordination both at the state level, the capital program level, as well as at the service level. So, I think there's a lot of work to be done. The statistics tell us that the numbers are only getting worse. Some of you may have seen the New York op-ed last Sunday around growing older, growing poorer.
9.9% of folks living in poverty are folks over the age of 65. I think those were the numbers cited there. And those numbers will continue to grow. So our challenge is before us, and we're so pleased to be working with CSCS and Leading Age and all of you on this issue. So without further ado, Bobby, thank you.
Power in this room around affordable housing. There's experience and expertise. And what we're clearly trying to do is harness that. And we want to bring it into the world of this tsunami of aging. I've aged into my own field. We could look around this room and elsewhere. And the good news is the reason we have a tsunami of aging is we're living long. Okay, so it's not like just this, somehow we think it's a depressing thing somehow, but it's actually good news. But what we need and what we ask you, and this is the hard work of after today, is to join us in coalition, to come up with a strategy. We will come up with recommendations. We will share them with you, and to continue to work with us and to put seniors front and center. And it's not really happening. And I think you've heard it in different ways today. And it's not about, that you're not all working very hard in your piece of this affordable housing pie. But we need to create a political will. We need it legislatively, we need it programmatically, and we certainly need it culturally, even within society, in terms of how we look at and treat older adults. And if you live long enough, they are us. And so I'm really, part of my call to action, when I think of call to action, data is important, but my call to action is how do we mobilize the troops? How do we get older adults involved? How do we get advocates and providers involved? How do we get those good folks in government that are working on this involved? Because the tsunami is here. And even though we need the data, we can't wait only for the data. So this conference is to open that space, to open it further, to say that when we have governmental meetings, advocacy meetings, whether or not somebody like me or someone from CSCS or a senior housing provider is at that table, that aging is talked about, because all too often it isn't. And how do we open that space? Because affordable housing is a social justice movement. And you've all been part of this for many years. And we need to expand this social justice movement across a lifespan. Because God knows that lifespan is expanding. And again, that's the good news of all of this. We welcome your ideas and suggestions. I invite you to go back and look at your legislative agendas, your reports, and other documentation in your organizations with an eye towards aging. Have you thought about how what we do affects older adults? I think even though it isn't the sexiest thing, the thing of looking at regulation is really important, as has come up in many ways today. So I think that in my final few words is that aging with dignity is a human right. And it's what we want for ourselves, what we want for our loved ones. And as we've heard today, if you don't have affordable housing and housing with services, then your human right to grow old with dignity in a city like New York you're being deprived of that human right. So that's my call to action, and I really hope we can just all work together. Thank you.
We're good. We're going to let you go home early. Listen, thanks everybody. I want to thank everybody who's participated, our government partners, Leading Age New York, public-private partnerships, which I think are really crucial, foundations who are here today, and everybody who's here. And we're going to be reaching out to you, and hopefully you'll be reaching out to us. This is the beginning. Thank you very much.